Good evening to you. This is Drive Time here on BBC Radio London, frequency 94.9. So I'm going to talk to Dave Murphy now. Dave is in the studio with me. Why am I talking to him? Well, he's improved his health, and apparently that of many others who have followed his lead through a rather unusual manner, by drinking his own urine. Dave Murphy says urine therapy has transformed his health, helped him lose weight, and even got rid of his asthma, and helps him maintain his youthful looks. Well, you do look very young, I suppose. I don't know how old you are, but
Thank you.
How old are you?
54.
54.
Mm-hmm.
Good afternoon to you, and thank
Hello.
you so much for coming. Where do you even start with this?
When do you start? Well, I started because I went to a festival and somebody was talking about it. And I walked in with my friends with our arms folded, like, tell us about drinking your wee lady. And she gave this talk that made us walk out going, we're going to have to try this. And all of us tried it the next day. And 6 years later, to my knowledge, all 5 of us are still doing it to this day.
What? I can't imagine the kind of speech somebody might have to give that would encourage me to do that.
Give me 15 minutes with you and you'll be doing it tomorrow.
No, you can't. I'll give 15 minutes with me. You'd be climbing the walls, but I wouldn't be doing that. I'd be cider, yeah. I'd be drinking brandy, yeah. What? So did you have any reservation about it?
Well, when I first started, I was as squeamish as anybody else would be, yeah. I saw the health benefits from the talk. Yeah, I understood how it worked, and
how my body, which is a finely tuned thing,
mm-hmm.
has developed a way of surviving. And what it does is I put food in, and it gets rid of waste. Part of that waste is urine. How is it that putting that back into my body is a good thing?
Because that's an erroneous interpretation. What happens is your blood goes to your liver screens out all the waste, all the viruses, toxins, whatever shouldn't be in the blood gets taken out by the liver. The purified blood goes to your kidneys, which are there to keep your blood in balance. So it siphons off all the excess of all the good stuff that's been carried along by your bloodstream. So the excess water, the excess minerals, vitamins, hormones, all the good stuff, because having too much of anything in the blood is just as bad as having not enough. So literally your urine is a snapshot of everything your body needs, but just happens to have too much of at that moment. And while it's sitting in your bladder, your body sometimes realizes it needs some of that stuff. So it will reabsorb it from the bladder, which is why some people have this experience where they're dying to go to the loo and they get distracted. And then an hour later, they realize they don't need to go to the loo because, while they were distracted.
But you're talking about biology, man. You're talking about my body and how it's worked and how it's
mm-hmm.
developed over thousands of years. You're not talking about me putting it in a glass and drinking it.
Well, this is when you see how this stuff works. It's amazing. So it's literally a way of getting all the good stuff that you need into the outside of you for outside use. I mean, if you cut yourself, you can try this, Nick. If you cut yourself,
no.
No, if you ever cut, no, I don't mean just go out and cut yourself. No. I mean, if you ever get a cut, yeah. Put the urine on it straight away. Yeah, but immediately it will stop bleeding.
That's because
within a minute it will heal over.
Yeah, well, that's because it works as an antiseptic, doesn't it? It works. It's effective. It takes out the germs. That's how it works.
No,
it's not meant to drink
it. Do you know how it works? Well, I've been studying it for the last 8 years. Yeah,
oh, right.
It works. Some of it works because it's got stem cells in it for one thing. The stem cells that literally roam around the body looking for things to repair.
Tell me before I bring in the doctor, who
mm-hmm.
I'm imagining is chomping at the bit to get.
Sure.
Well, that's fine. It's chomping at the bit to get on. Tell me about you then and you now.
Okay, me then. I was nearly 20 stone. I had chronic asthma, so much that I couldn't walk maybe 100 yards without needing to rest. I had back problems, high blood pressure, high cholesterol, I had nerve damage inside my foot. I had pain up the back of my leg after an Achilles tendon operation. I couldn't lift my my arm above shoulder
Well, you just
height.
change your diet. Eat less. How about that?
I tried all sorts of things.
What, eating less?
Yes.
Eating better food? And that didn't work for you?
Nothing seemed to work. I had a few sort of, minor successes with hydrogen peroxide and a few other little things, but nothing seemed to actually work until I tried urine therapy.
Let's bring in our doctor, shall we? Dr Sarah Jarvis, London GP and Clinical Director of patient.co.uk. Good afternoon to you, Sarah.
Good afternoon.
Thanks so much for joining us. I mean, look, it's not the first... I'm doing this, oh my goodness thing, but actually, I remember, was it Hayley Mills? There were lots of people who have been talking about this for quite some time. And once they've done it, are all very passionate about the health benefits. It won't be the first time you've heard this.
Well, they're not all very passionate about it. The people who are very passionate about it tend to talk about it. But of course, what we know is that there have been no randomised control trials and certainly no double-blind randomised control trials. I love the way your caller, Dave, said, he thinks that by saying it's an erroneous interpretation, let me use long words and people think it's more scientific. No, it's not, because he used a terribly simple word there, which was that your kidneys your body uses your kidneys to get rid of excess, rid of things that you don't need, that you have too much of. At best, you might get a bit of calcium, you might get a bit of magnesium back into your body. But actually, do you know what? You could do that by using a healthy, balanced diet. There is absolutely no reason whatsoever. And he's going to say that he felt a great deal better. Do you know why? Because he spoke to somebody who was incredibly inspirational and he believed that he was going to feel
But he's lost weight. But he has lost weight.
Yeah, and there is even he, and that's saying something, cannot come up with any reason whatsoever why drinking something that is 95% water and contains small amounts of vitamins and minerals should make...
But he doesn't have to, does he? Doctor, he doesn't have to. All he has to do is present better, lighter and healthier than he was before.
Yeah, but no, he doesn't have to, because the point is that my argument to that is he believes that he's going to be better, lighter and healthier than he was before. He feels he has more energy, therefore he does more, therefore he expends more calories, therefore he's going to lose more weight. The whole point about these things, we heard last week a great deal in the media about the nocebo effect. It's absolutely been proven that. People who are taking statins do get muscle pains, but they only get muscle pains if they think they're going to get muscle pains, because the people who were in the double-blind trial who hadn't been told they might get muscle pains didn't get them any more often than the people on placebo. That's the point. He heard somebody very inspirational. She told him, she convinced him that it was going to make him feel better. Therefore, it made him feel better. Once he felt better, he started doing more, he started being more active, and therefore he lost weight. And
there's a lesson for you to learn in those surgeries then, isn't there? Just when people come in, just say, look, and then give them a glass of water. No, I mean, if I follow your argument all the way through, just tell them, here, we've got this magic fluid, which is whatever, water, and give it to them, but give them a lovely story, or play them a tape, give them a DVD, and then they'll be better, won't they?
Well, of course, the tragedy is that's exactly what's happening with things like homeopathy as well, and yet people swear by it. The whole point is that this is the reason that we are scientists. This is the reason that we have drugs. The simple fact of the matter is drinking urine almost certainly is not going to do you any harm, except your taste buds, clearly, in the long term.
So just to be clear, and I like being clear, it is not something you're going to prescribe.
It is not something any doctor I have ever heard of, or any scientist I have ever heard of, who understands the remotest thing about medicine is ever going to prescribe.
Thank you very much, Dr. Sarah Jarvis, the London GP and Clinical Director of patient.co.uk. David, I'll give you the last word on this.
Well, first of all, they won't do any clinical trials, because they won't do any clinical trials on it, because it will prove that it will help people. So
here's a doctor who has studied for 6 years to gain a qualification, who's dedicated her life to helping, saving and improving the life of others, and you still argue with her that drinking your wee is a good thing.
Yes, because I don't have anything against any doctor, but it's not the doctors themselves, it's what they're being taught This is wrong. Allopathic medicine is about treating symptoms, not the actual illness. It's like taking your car into a garage when the engine warning light comes on and the mechanic taking the bulb out. The symptom's gone, but the problem's still there. But the thing is, you're not aware of it anymore because the light's not coming on. So the problem gets worse and worse and worse, and something else catastrophic happens later on.
Fascinating talking to you. Look after yourself, and thank you very much for coming in. I appreciate it. Dave Murphy there talking about it. That homeopathy one. Oh, she touched a nerve on that one as well, didn't she? BBC Radio London, frequency 94.9. News to come first with the BBC Radio London Travel.